Hi, everyone. I'm Michelle Lewis with Siouxland District Health Department. I am the Director of Health Promotions and Population Health, and I'm going to be talking to you this month about preventative screenings and what we're doing as far as the work in our coalition. So as you can see on the screen, our overall goal, and that is to increase care or increase preventative care service utilization in Siouxland to address the growing needs of preventable conditions. And then we have one objective, and again, that's just really increasing awareness of what the screening recommendations are, the timelines, and then to increase the availability for people to go ahead and get those preventative screenings in the next few years. We do have 3 strategies on how we're going to go about doing that, and they're listed there too. We're going to be working with the medical providers in the community. We'll be working with our employers, our work sites, and then also just with the general public. So you might be asking, why the focus? Why are we, looking at preventative care services? Here's some statistics that show why preventative care is so important. We will be looking to have a high rate of new cancer incidences in 2023 in our county. We will also be having one of the highest rates of cancer deaths in 2023. Woodbury County also has had the highest rate of STIs the last few years. Our heart attack hospitalizations have also continued to go up. Our immunizations have gone down. All of these types of things could all be impacted and improved upon with preventative care. Also, senior primary care physician can help with that. And right now we have nearly 15,000 Woodbury County residents that do not have a primary care physician. So we are going to, like I said, focus on 3 different things as to how we can improve the utilization of preventative services and to get more people in for screenings. The first focus is with our medical providers. We do have a lot of people that utilize urgent cares and emergency rooms instead of seeing a primary care physician for any kind of health concerns. And by going to see a primary care physician on a regular basis, an annual basis, they are keeping track of when we are due for some type of screening and testing and whatnot. And so right now, a lot of our EDs and urgent cares kind of have a process where if they see one of their clients that come in and they don't have a primary care physician listed within their medical chart, they're just going to kind of do a simple ask of, why don't you have one? Would you like to have one? We can easily get you scheduled for one, and then kind of explain kind of in an elevator speech as to what the benefits of having a primary care physician is. The second focus is with our employers. We are going to be working with them to really encourage them to share their insurance information with their staff on an annual basis. A lot of insurances cover these preventative screenings fully, and employees are just not aware of it. They don't know how to fully utilize their insurance to the best of the potential that it has. So really working on sharing the coverage of their insurance plans, but then also kind of being creative in how they can be more flexible with their staff so that they can get in for those preventative screenings, possibly during the workday. And the last focus is just utilizing the general public to push out some media campaigns on different preventative services that are available. So we will be having, we've kind of categorized the entire campaign as Prevention 101. And each month we are going to be pushing out one topic that is around preventative health. And so in August, which is our first month, it was on immunizations. Like in September, it will be on prostate screenings. So every month, whether you're, maybe at a work site or at your doctor's office or just seeing it on general social media or through the media, that we will all be sharing that same topic for that same preventative health screening. So basically today, what can you do? If you or your family member, coworker, friend does not have a primary care physician, I highly encourage you to seek one out. Call today, call in the next week to find one and get an appointment scheduled. If you work at a work site and kind of at a supervisory, director level, to really look into having an insurance rep come and share information to your employees on what the insurance covers. Also, just being more flexible with allowing employees to get in for those screenings. And the third one, for those Preventative 101 wellness campaigns, if you are at a work site and you would like to have that information shared or available to share, reach out to me and I can kind of send you that packet of information that has social media posts, flyers or posters that you can share in the exam rooms, break rooms, that type of thing, just so that we can it's another outlet as to where we can get that information shared. So my contact information is here. Really hope that you can have seen the benefits of why we do need to do preventative screening and how easy it is to kind of, like I said, get hooked up with a primary care physician that's going to kind of guide you on what you're due for each year. So thank you.